celebrating and showcasing extraordinary people who are doing incredible things to make our world a better place. This is Close Up Television. I'm your host, Jim Masters, and thanks for joining us. On today's episode, we celebrate Dr. Leslie Davis. Dr. Leslie is a licensed clinical professional counselor, national certified counselor, and executive contributor to Brains Magazine. She also hosts a popular podcast called She Matters on Apple Podcasts and Spotify. Her role as a compassionate counselor and relationship coach is transformative, life-affirming, and a significant part of who she is because ever since she was young, she always found joy in helping people overcome difficulties. She offers unique support and guidance to her clients who are dealing with anxiety, heartache, and uncertainty during life transitions. That empowers us to create our lives and envision more possibilities and to help people see themselves more clearly so they can make better choices. In her role as a therapist, Dr. Leslie works with teens and young adults and women struggling with symptoms of anxiety and depression that may be triggered by and cause significant issues in their relationships. Some have undergone extreme trauma like sexual abuse. She also works with individuals diagnosed with personality disorders who are intensely vulnerable and feeling lost, invalidated, and rejected. Dr. Leslie is gifted at creating a positive connection with these individuals by gaining their trust so they open up and find self-acceptance and relief. She has also created and implemented a unique program called Heartbeats, designed for youth struggling with anger and low self-esteem due to experiences with violence. Dr. Leslie's counseling is incredible. It helps people begin to finally embrace hope and self-acceptance. To learn more about her work, she joins me today in the Close Up Television studios for this exclusive interview. Dr. Leslie, thanks so much for joining us here at the Close Up Television studio and coming up from St. Louis by way of Chicago to our studios here. We, of course, did the Close Up radio show, had a fantastic conversation, and wanted to explore some more. I was fascinated by your background, so welcome.
Thank you for having me.
Tell me, I know we talked a little bit about this in the radio series, but maybe we can expand a little bit more on some of the things that pointed you in the journey of your own journey of doing this work, some of the things that inspired you. You know, when we do different things in life that we love doing and that we become really good at, a lot of times it's because there are things in our life that sort of popped up that let us know this is work we're supposed to do. Not just work we like doing, but we're meant to do this work. It's in our DNA. And for you, this work as a counselor and a therapist really, truly is. How did that all begin for you?
It started at a very young age. I was in my teen years, and during that time, I just happened to notice that a lot of people would come to me for advice. And a lot of times those people that are older than me that would ask me, well, what do you think I should do about this? And it was always about relationships. And that was something I paid attention to, and I started studying relationships and marriages. I still have not been married, but I know a lot about marriage and relationships. And I think over the years, I just naturally noticed how people would tell me their stories. For example, I would go to the post office just to buy stamps, and the lady that's selling me stamps is telling me what happened to her that day. And I'm holding up the line because we're having a 10-minute conversation
like
about what's going on. So I think I just naturally attract people, and I just make them feel comfortable where they want to share their story with me.
So tell us about the journey from having that background where people are just coming up to you and pouring their hearts out to you because you were listening, you're an empathetic ear, you were concerned, whether they're telling you things at the post office or the supermarket, you were paid heed to that. How did you take that knowledge that you have this gift to help people sort of heal and work through things, and then turn it into the work that you're doing? What was the journey of linking the understanding of this is what you are and who you're meant to be, but then getting the background and the education and building all that up?
So I'm the type of person that holds on to meaningful items such as papers from college and high school.
Me too.
And just a few years ago, I happened to come across a box of some of the papers I've written in high school and college, and I remember finding my entrance paper to get into Wheaton College, and I had to decide at that moment, you know, what did I want to do with my life? What did I want to do with my degree? And I knew right then I wanted to be a counselor from the very beginning. And every year, every time I, advanced my college, my academics, I would write about my purpose and what am I going to do with this degree. And it always had a similar theme of helping others, helping people with relationships. And so over time, I started studying more, not just because of school, but it was something I was interested in. I think the work I did working in foster care, so working in child welfare, just seeing so many broken families and broken hearts, it was something that really pulled on me. And that was something that I felt a need to address myself. Seeing some of the kids that grew up in foster care that really struggled to connect with someone because they were bounced around from home to home. And I was always the caseworker that would be dedicated to staying with them. That's another issue that happens in child welfare too, that the caseworker is the person that's so vital in that child's life ends up leaving.
Yeah.
And so foster kids, they don't have a way to connect. They usually want to connect with people, but they don't know how to do that. And I became that person for them.
That's fantastic. How do you describe the kind of counseling that you do? There are so many different types and genres. How do you break it out as far as the type that you specialize in?
I like to say that I'm a person-centered therapist, but I recently came across emotion-focused therapy. I recently completed the first stage of becoming a certified emotion-focused therapist. And I'm actually going to a training later this month to do stage 2.
Tell us what that is.
Yeah, emotion-focused therapy is so interesting. So a lot of times we don't want to tap into our feelings. It's uncomfortable. It's hard to even verbalize how we feel. A lot of people are just focused on the basics of emotions, like I'm sad, I'm happy, I'm mad. And we don't tap into other emotions like I'm excited, I'm elated, I'm disappointed, I'm afraid. And so emotion-focused therapy helps us tap into what are we really feeling, what triggered that feeling, what do we do with that when we are triggered by that emotion, and how do we want to change that?
So that's a whole new area that we're exploring, right? Where we're actually getting a little bit deeper because instead of, again, treating the symptom, we're really looking further and going into the cause because a lot of the ways that we react and the ways we think are due to underlying unresolved issues in our lives, right?
Absolutely.
Sometimes go all the way back to childhood.
Yeah, that happens a lot with those who have been traumatized, where they turn off their emotions because of that trauma. They don't want to revisit what that trauma felt like. And any moment they get that's a new trigger that sets them back to that original emotion, they try to escape that, a lot of times in unhealthy ways. And so I come into, helping them understand this is what you're feeling, this is why you're feeling that way, and you don't have to feel that way anymore. You can choose to feel differently.
So what are some of the issues that your clients are dealing with? I mean, our world is so fast-paced now. It's a 24/7 lifestyle, and we've just been going through and still going through elements of the pandemic, which has brought on a whole new understanding, appreciation of mental health and mental fitness and relationships. And, a lot of relationships during that period were strained and reevaluated. In today's fast-paced society, what are some of the things you find that your clients are dealing with?
Yeah, there's a lot of depression, a lot of anxiety. I think anxiety has heightened over the last few years with the pandemic. One thing that I was concerned about as a therapist during the pandemic was the rise of domestic violence. And knowing that, we were all secluded, we're staying in our own homes, and knowing that, victims of domestic violence, if they have no way to escape, and at that time we were told to stay home, you can't go anywhere.
Right.
So that kind of heightens that opportunity to be abused.
Right.
Yeah, and there's no way to get out of that. There's no escape because you can't talk to a neighbor, you can't call a friend, you can't leave your house even to get help if you needed to. So a lot of the clients that I work with, they have backgrounds in violence of some sort, whether sexual violence, domestic violence in a relationship. They deal with a lot of insecurities because of relationships. And so that's one thing that I like to talk about is attachment styles and helping them become more secure in their attachment.
Let's talk about attachment styles. What is that?
Attachment styles, it's a great theory. So the theory basically talks about how our attachment style is developed when we're an infant or the toddler stage. and it's based off of how we interact with our primary caregiver. So that primary caregiver could be our parent, it could be a grandparent, or a foster parent. And depending on how you were treated at that age, you develop either a secure attachment, you can be anxious or avoidant, and there's also disorganized attachment, but I just like to focus on the basic three. And one thing to keep in mind is that attachment styles can change over time. That's something I came across during my studies and my PhD journey, that a lot of times people develop their attachment style early on, and depending on who they're interacting with, that attachment style can be different. So I could be secure in my attachment with my partner, but maybe I'm anxious around my attachment with a friend or even my mother. So it just depends on who you're interacting with.
It's really fascinating when you break it down, because again, it's all connected. There's reasons for everything on so many different levels. What is a typical session like when you're working with somebody?
So I always start with the intake session. So I want to get to know the story. And I don't like to read people's information before I see them, because I don't want to make a prejudgment of what their story is about. So I meet them either by video or in the office, and we just talk, and I treat it as a conversation. A lot of people have this idea of therapy or coaching is, I'm coming in here, I'm going to tell you how I feel, and you're just going to nod and say, okay.
Right.
And I'm not that type of therapist.
Right.
I tell all my clients, every conversation we have, I'm never going to sugarcoat it for you. I'm going to tell you how it is. And so we talk, and I get a basis of where they are, and we set goals and say, where do you want to be? And I'm going to help you get there. And I treat every client, I tell them, I'm your mirror. So whatever you give me, I just reflect that back, and you're going to see yourself better. You're going to see yourself in a different light.
That's fantastic. And what's some of the feedback you get from clients as they are realizing there is hope and there is opportunity for healing in their lives?
A lot of times, I think most of my clients will say, I'm different from every therapist that they've worked with, or different from any coach they've worked with, and they don't know exactly why. I don't know exactly why. I think we just have a good connection. I think every client I've worked with, there's been a positive interaction, a positive connection with them, where it doesn't feel like work to me, and that might be what the difference is it's not a job, it's really who I am.
You probably work, I'm sure, with people from all different backgrounds and hopes, dreams, desires, but is there an ideal client? Is there an ideal person that you work with?
Yes, my ideal client is the brokenhearted woman who wants to heal and empower herself so she can empower others. So if I think about my ideal client, it's someone who may have had a background of trauma, but they clearly don't see themselves in the best light that they can see themselves. And my job is to step in and show them this is who you are. You're not the brokenhearted person. You're not a broken vessel. You're really someone who has been hurt, but you can overcome that hurt so you can help other people get through that hurt.
See, that's what it is. It's like a paying forward situation, which I think is beautiful. You also work with teens and young adults because you implemented a program called Heartbeats.
Yeah.
Let's talk about that.
Yeah, I love the Heartbeats program. So I started the Heartbeats program about almost 7 years ago, and it developed from 10 sessions to 12. And I talk about different things that are relevant for someone who has experienced violence in different ways. So either as a victim of violence, the perpetrator of violence, or a witness. And so that program, Heartbeats, is for those who are 12 to 17. Sometimes I work with 18-year-olds. And it gives them the basics of relationships, learning how to communicate, learning what is the cycle of violence. It helps them learn how to look at what's power and control. That's something that we don't talk about in schools, but they experience it, they see it, they may have engaged in that themselves as the perpetrator. And so I help them see what is the cycle so they can break out of that cycle.
You're seeing a lot of kids today who are dealing with mental health issues, and the pandemic has exacerbated that, as we were saying. What are some of the other things that kids today are really dealing with? I mean, when I was a kid, and probably for you too, when you were a kid, we were kids.
Yeah.
We were outside, we were in the pool, we were playing baseball. We had the opportunity to still be children. We didn't always know everything that the adults had to deal with because we were kids. Today, kids can go up in their bedroom And it's like NASA. If the parent doesn't say something, they can go up and find out just Googling it. Yeah. So that can really have an impact on them. What are some of the things you think that they're really dealing with in our society, which is everything? They're like many adults.
Yeah, there's so much kids are dealing with nowadays. I think the biggest challenge for the youth nowadays is that they're just lost and they don't really have anyone to connect to. They really don't even know how to connect to each other as peers.
Each other, right.
And that's been, I think it's worse for them because they're going through the pandemic, when that hit. They were ripped out of school, ripped away from their connections, and that's such a formative time in their life where they need to connect with others. And so with them losing that and only, being thrown in the house by themselves, or maybe there's a working parent that had to still go to work and they're left at home alone all day now instead of being able to go to school and connect with others.
Yeah.
Or maybe they were in a position where they're in a house where there's violence and they have no way of escape. They have no way to protect themselves or their family members that are being hurt. But with the youth that are feeling lost, I think there's so much confusion that comes out of that. They don't know who they are. They don't know what direction to go. And so one thing I've noticed just the last few years is that some of the youth don't even have a plan for themselves when they graduate. They can't even see, 5 years from now what their life, what they want it to look like. And I think that's a concern that we really need to address as a society is really being more hands-on with the youth. And that's one of the reasons why I brought my son with me today.
Yes, who's in our control room right now watching the whole process because he's studying.
He's in school for graphic communications and he wants to be a social media editor.
Oh, that's right up. You're both in fields that are in high demand. Yes. I would imagine with the work that you do, your phone must ring a lot. You must be very busy. You know what I mean?
I had to put it on Do Not Disturb today because I was getting phone calls earlier.
Yes, our cell phones are off.
Yes.
They're close by, but they're off.
Yeah.
Do you see an uptick unfortunately, in these types of situations that are happening with people, the trauma, the violence, the road rage, the depression, anxiety, people just wandering very unhappy, scared, confused. I mean, I see it just on the highways, how edgy everybody is and the road rage that's going on and sort of the arguments in stores and just stuff that like, you'd always have maybe one person, and it seems like a lot of people are just, Yeah,
everyone's on edge.
Yeah.
And I think there is an influx of those who want therapy, that want help, because the stigma of therapy has dissipated just a little.
Yes.
It's still there, but more people are talking about my therapist said, or...
It's almost like cachet.
Yeah.
It's cool to say that you have.
Yeah.
Especially in Hollywood.
I have one client that she started writing down the things that I would say in session. Sometimes I forget what I might say in a session. And she was like, I'm going to write a book about my therapist Leslie told me. I'm like, okay. But no, there's a high need, there's a high demand, and I would say there's a challenge in having high quality professional mental health services. A lot of people can't afford quality mental health care if they don't have insurance or if they can't pay out of pocket. There's therapists who are only private pay, like myself,
right.
And so they may want to work with me, but they can't afford the service. But I think that when the society sees that this is such a need, there's the rise in suicide, there's a rise in violence, and we have to do something. And so I think society needs to come together to make a way for that to happen, make a way for those who really need the help, where it is affordable or it's something that is at no cost. And that's one reason why I started my podcast, She Matters. It's a free educational service for Black single moms specifically, to address their relationship issues.
You mentioned social media. How has social media come into play and maybe sort of exacerbated some of these issues? Because like you talk about suicide and anxiety and depression, and the research is pointing to the fact that a lot of people that are on social media a lot or constantly, like it's the first thing they check before they even brush their teeth or have a cup of coffee in the morning, they go right to the phone and did they like my photo?
Yeah.
Did they respond to my comment on Instagram and elsewhere? There have been situations where people have live streamed violence, live streamed suicide, online, and the fighting back and forth and the competing, my photo looks better than yours and all that. How has that added to all of this, the rise of this displeasure in society and the unhappiness?
Yeah, I think it's made it worse. And one thing that is quite bothersome for me is there are a lot of people who make, TikTok videos. Even therapists are getting into this where they want to offer help. And a lot of times the person who is seeing that video, even though it might be professional, it might be the right information, because there's not a therapeutic relationship there.
Right. It's just
the information is taken the wrong way.
30-second video.
Yeah. And it can be dangerous to get into those TikTok videos and you see one after another and people start to self-diagnose.
Right.
And what they're self-diagnosing may be inaccurate. So they're getting information that's not really helping them. And that's the danger of social media right now.
And they're saying, like you're on Instagram, somebody will, especially the females, when they take a photo, they'll take about 200 before they will put the one up.
Yeah.
That's filtered and doctored up and photoshopped, and it's not even really them. That's a whole other thing, you know?
Yeah.
It's just made things a little interesting, right?
And that's why I'm really big about never sugarcoating anything. I want to be real and raw, because you do see so much that's just, it's a game. We fall into that trap of I have to be perfect, or I have to, make sure I present myself the way I want people to see me. And what we forget is people will see us the way they want to see us. We don't really have control over that.
What happens if they catch you one day when you don't look and sound the way you presented? Then what? How do you maintain that existence of being just that role?
It's a lot of work.
Yeah. It's kind of like they say the legendary actress Joan Crawford, who was born Lucille LeSueur in Texas, but then she took on the persona of Joan Crawford, and she would always be Joan Crawford. Her speech, the way she looked, the way she presented herself, she was always on, always the legendary movie actress. You didn't necessarily get a chance to see her as just Lucille. You saw her as the image of Joan Crawford. Some people do that a lot. You mentioned counseling and therapy. What is the difference from your perspective of counseling and therapy, of being a counselor and a therapist? I know there's certain elements that blend, but then there's distinct differences between the two, right?
Yes. I would say the blend is that both fields are helping someone be better. Someone's going to come because they need support or they need guidance, and so they'll either seek a therapist or a coach. But the difference is, a coach cannot treat someone's mental health issues. So there might be an individual who has symptoms of depression or symptoms of anxiety, or they may have bipolar disorder, and the coach cannot help that person with those specific needs. That's what the therapist is for. And so if there's a coach who's doing things ethically, they should mention, I can only treat you, or I can only help you as a coach, but if there are these symptoms that come up during our conversation, I'm going to have to refer you to a therapist for that part of your need.
So how much of your work is really doing the counseling and the therapeutic side of things? Is it the majority of what you're doing?
It is for now, because I just recently started my coaching business. So I think my coaching business will be a year in the next few months. So that's something new for me. And the reason why I branched out into coaching is because I wanted to have a bigger reach and something that's more global, because I can't reach everyone just as a therapist.
So what's your plans? What's your hope with that? In addition to reaching more people?
Yes, I really want to empower women around the world. And the only way I'm going to do that is through coaching, giving information, and support from my heart, and empowering women to really break free from toxic relationships. That is my goal. If I can just save a life because they broke free from a toxic relationship, that is my goal, and I would achieve that goal. And
why do you work specifically with women? What is it about women specifically that speaks to you, where you find that maybe they're being underserved perhaps, and that you want to sort of fill that void?
Well, I am a woman, for one, so I can identify with other
That's
women. But knowing that,
I
women...
can confirm that.
There's this phrase, women rule the world, or
Yeah,
there's,
yeah.
we have so much power, which is true. There has to be a balance there with men, of course. But women we have so much strength that is sometimes hidden, and we make ourselves small. And so I want to empower women to just really be themselves. I think that's a process, right? First you have to know, who are you?
Right.
Where did you come from? If I look at myself, I know who I am today, but I have to look back and see, well, where did I gain these strengths? Where did I get that from? A lot of times it's not just from family, it's from everyone that I've encountered. I've taken little bits and pieces of those interactions, and that's who I became. Which
I think is absolutely fantastic. How can we challenge sort of that stereotype of, the single mom, and why is that so important to really challenge that? And what is today that stereotype of what the single mom's all about?
I was going to ask you that. So if you think about a single mom, what comes to mind?
Somebody who is overworked, maybe underappreciated, who's trying to juggle and balance a lot of different things at the same time. Maybe it's making sure there's food on the table, that there's income coming in, and that the child or children are being cared for, while also somehow trying to squeeze out a minute or two for themselves, and trying to sort of juggle all of that at the same time.
Yeah. Well, I'll tell you.
Am I close?
You're close. So I can identify with some of that. I'm a single mom. I was a single mom. My son is 18 now. Been a single mom the whole time. I think the stereotype that you mentioned, that's what most people think.
The juggling, they're trying to do it all.
That she's struggling.
Yeah.
Yeah, and the reason why I want to address that stigma and that stereotype is that not all single moms present that way. I'm not struggling. I had to work hard not to...
Self-made.
Yeah, I had to work hard not to struggle.
Right.
But it's something that was intentional for me.
Right.
And so the purpose of me wanting to address that stereotype is to let other moms who do fit that stereotype know that they don't have to be that way.
Right.
They don't have to live like that.
Right.
They can be empowered. They can work hard. They can go to school while their child is in school. They can work a fantastic job, whatever job they want, while their child is in school, and they can be the provider.
Right.
They can do all those things. It's just a matter of empowering themselves to do it.
And you notice you really don't hear that a lot, like you mentioned, the struggling stereotype with single dads for some reason. You don't hear that sort of comparison or the thought in that way, which is amazing. That's so changing those stereotypes is very important. Is it changing?
That's a good question.
Did you get that expression on her?
So is that changing? I think it will change once the face of the single mom that's not struggling is more in the forefront.
Yes, right.
Yeah.
So how do you make that happen?
Well, I'm doing that now. I'm living my life.
You're on close-up television.
That's right. I'm living my life in front of others. I'm very transparent. I don't want to keep any secrets about who I am, because I feel like my life is part of someone else's journey of empowering themselves. So I live my life in a way that, it's not just about me. I always do things because it's for someone else's need.
A lot of times when I chat with and have conversations on close-up television and radio with our guests, a lot of them do what they do as a result of things they themselves have experienced in their own lives. And because they've gone through things, they've experienced things, and they've come through things, and they're so excited about that, they want to show others how they too can do that. Is part of as well what you're doing for your career, this passion that you have for it, this desire and need to do what you do, also tied to your own experiences in your own life, which also make you very relatable to your clients?
Yes, absolutely. So I'm not afraid to share that I've been through toxic relationships, multiple. A lot of that, there's reasons for that.
Sure.
I may not have known better. And one thing I find interesting about my experience of being in a toxic relationship is that was not something that was modeled for me. I didn't grow up in a home where there was violence. I didn't grow up in a home where there's arguing. I was raised by my mom, who's a single mom. I had a great relationship with both my parents. They had great relationships with each other. They just didn't stay together. And I think I had to go through that experience of being in a toxic relationship so I can do the work that I'm doing now. If I didn't have that experience, I wouldn't be able to understand why someone would stay in a violent relationship, or why a woman would choose to engage with people who are kind of similar, like dating the same type of person over and over.
Domineering or whatever it may be, right?
Yeah. And so if I didn't experience that, I wouldn't know how to really help them. I would only be helping them from a textbook.
Right, exactly. The clinical point of view, which I think is fantastic. That's what I love about folks like you who are doing that, because you walk the walk, talk the talk. You're very relatable to your clients. You can, when you're engaging with them and they're engaging with you, you can really understand and empathize with what it is they're trying to express to you. Because oftentimes, I don't doubt that they probably tell you things that they don't even tell their closest loved ones and friends.
All the time.
So one of the big things I would imagine too is the early onset establishment in the very beginning of trust between you and the client and you, and sort of creating this safe space so they can allow maybe even possibly traumatic and painful things they've been squashing down to sort of rise to the surface so they can finally work through it and release some of it. Trust is paramount, right? Yes.
I think I established trust very early on with the first connection that I make with them. And I think I do that in a way that is, I'm myself, and I tell them that this is who I am. So who you get today in this session, that's who I am out of session. I'm not going to change up on you just because I'm in a therapist chair right now.
Right.
And I think one way that I do that is I make eye contact. I ask them questions. I'm not asking them questions off of a checklist. It's just having a conversation with them.
Which is important.
Yeah.
Why do you think so many relationships actually fail?
Because people are selfish. That's the biggest reason.
Right.
Yeah. If I'm not getting what I want, then and you're not giving it to me, I'm going to leave, or I'm going to do something to make you feel bad until you give me what I want.
Right. Disposable society they talk about. Yeah. So you work with, because you're involved in relationships as well. How do you work with folks who are struggling in their relationships? What are some of the things you do to work with those clients?
I help them understand, what is it that they want from the relationship? Why did they even get into the relationship for the first thing? What do you like about that person you're with? What do you not like about that person? Is that something you can change? And can you live with the things that you can't change?
Is it one-on-one, or are you dealing with couples, or is it all of the above?
All of that. So I do work with individuals, mostly through coaching, but I do work with couples for therapy. And I do use EFT to practice with them.
Emotion focused therapy. Yeah. Oh, yes. Yeah. That's really, really good, huh?
It's powerful. I'll share just a quick thing with that. There was a couple, I think it was their second session. So after their intake session, where I was just getting their story and what do they want to work on. And I started out with the husband and helped him process, what was he feeling. And by the end of that session, he was in tears. And that's not common to see a man bawling in my office, but knowing that EFT worked, and they bought into that process. And so that's something that we're working through right now.
Tell our viewers what that actually is, how that works,
EFT?
How you use it. Yeah,
well, emotion-focused therapy, it's a process where, especially with couples, where you really focus on one partner and the other partner is encouraged to just listen and pay attention to the body language and the body cues. So one partner might share what they're feeling. So maybe their partner said something that hurt them, and that helped them understand, well, how did you respond to that? What were you feeling when that happened? What are you feeling right now, as we're talking about that, and tapping into that emotion specifically. And as that's happening, that process allows the partner to see this is how they really feel. So I might have seen an explosion of anger, but they really are just afraid that I'm going to leave them, or they're nervous about something that they've done that's going to trigger me to do something. It's a beautiful process because both people are really engaged, even though one is just listening, but they both get healing from that same time.
What do you do sometimes? I'm sure you come across people who they know that they need to work on these things, but they're resistant to open up. Maybe it could be culturally, maybe it's just they've had to, through their life, suppress feelings. Maybe they've always been told, get over it, don't worry about it, it's not that big deal, this too shall pass, all the things everybody hears. So you're working with them and you're ready to help them, but you can tell they have armor that's like steel. How do you work with them to sort of get past that armor and sort of melt the ice?
Yeah, the type of person I am, I confront it right away. If I see it, I'll, mention your body language is showing me this, what's going on. So I don't let that fester. I don't let that sit there.
So you see it, you say, look, come on, let's take care of that first, right off.
Yeah, and the point is, you're here in the office, right? You came here for a reason. You must want to address something in your life. So putting on this shell and being hard is not helping it. And as soon as I, verbalize that I see it, they're like, okay, well, let me tell you what's really going on. So
they're
it doesn't take much time.
And the jig is up type thing, which is good.
Yeah.
Also, too, I would imagine, a lot of times you may have clients who will want you to sort of not live their life for them, but they don't want to necessarily take responsibility. They want you to hold their hand all the time. What you're doing is you're trying to instill these things in them, so when Dr. Leslie isn't in the room or on the phone or on Zoom or whatever it is, they can call upon these things. Oh yeah, okay, I'm dealing with this situation right now. I remember Dr. Leslie told me that this is the way to handle this.
Yeah.
So they really do have to step up and take responsibility for their own actions, their own thoughts, their own life, past, present, and future, because you can't be there 24/7 and you can't or wouldn't want to hold their hand constantly, because it doesn't necessarily help them, right?
Yeah. I let clients know from the beginning that, I'm on this journey with you right now, but I'm not here forever. So I'm giving you tools to work with, and you have a choice if you're going to pick up that tool and use it. I'm not a magic eraser. I can't erase things that have happened to you in the past, but I will give you the tools, and you have to decide, when I'm out of this office, I'm going to do this. So I'm a big fan of homework for my clients.
Yeah.
I give them maybe something to write in their journal, or I help them give them some prompt to think about during the week. So if it's something that came up in a session, I'll ask them to think about, well, if you notice this happening during the week, make sure you send me an email or a little quick note to say, hey, this happened, so we can talk about it during the next session.
I like that.
Yeah.
How do you deal with somebody who has tried therapy before, but their experience really wasn't that great?
It's really, I help them understand that, you have to find the right therapist. Not all therapists are made for all people.
Right.
We all have different styles, we have different backgrounds personally, we have different cultural backgrounds, and we may not necessarily fit with all clients.
Right.
So we have to empower clients to choose when they want to walk away. So I always ask clients at the end of every session, do you want to schedule another one? When do you want to meet again? Because they have the power to say, this isn't working for me. And that's a conversation that needs to be had with the client and the therapist, or with the coach, because you have to empower the client to make that choice for themselves. We're not here to dictate what they do with their lives. So I also like to help clients understand that there might be a therapist that is more culturally competent. So for example, if there's a Black single mom who has this stigma of what therapy is like and is afraid to open up because she has a white therapist who's going to hotline her or have her kids taken away if she opens up about being depressed or suicidal, she's not going to be honest in that session.
She's going to hold back.
Yeah, and so telling someone from the beginning, if you have a therapist that you don't feel comfortable with, it's okay to step away from that therapeutic relationship. It's a choice. All relationships are a choice.
Choice, exactly.
Yeah.
Why is it also important that people do really seek help for trauma that they've experienced?
Well, if you don't address the trauma,
it
you
builds
get
up
stuck.
and it festers and probably comes out in other ways that you'd rather it not be coming out, right?
Yeah, and that trauma that we hold on to, it affects all of our relationships, whether we want to recognize that or not.
Mind, body, and spirit. The body reacts to unresolved trauma, right? Illnesses and dis-ease and all of that, right?
Yeah.
So it's important to, and traumas can be, you know, sometimes when we think trauma, we're always thinking of an emergency room, physical trauma.
Yeah.
But there's trauma where maybe throughout your life you were always told you're not good enough, you'll never amount to anything, you're not as good as your brother or your sister or your, you know, the comparisons. And or maybe working with employers who aren't showing you respect or whatever it is. It's important to work through all that, right?
Yeah. There's, you're talking about employers, just brought up a memory of something I read in this book about gaslighting recently, and just noticing that gaslighters can come in different forms. You know, it's not just a romantic partner. Gaslighters can be, you know, your parent or a sibling or your friend even. So if you're in a relationship with a gaslighter, that can be traumatizing. That's something that you'll never forget, because gaslighters will attack your mind, right? They attack your spirit. They want to break you down. And that hurts, and that sticks with us. So if we can recognize, hey, I'm in a relationship with a gaslighter, you know, that takes a lot of work to get out of that, right? That can take years to get out of that power and control that a gaslighter has over you.
How do you define, for somebody who's hearing gaslighter for the first time, what a gaslighter actually is?
Yeah, I think a gaslighter is someone who uses power and control to manipulate someone to get what they want. And a lot of times gaslighters don't really have the capacity to show empathy. And so they may not do it intentionally all the time, but a lot of times the behaviors that they use, the tactics they use, is for their own benefit.
They'll push the buttons, they'll light the fire, create the fire.
It makes you feel like you're going crazy.
Like you're the one that's going crazy.
Yeah.
You mentioned your realness and your authenticity. What are some other ways that you describe your specific counseling style?
That's a great question. I feel like I'm eclectic. I'm the type of person that, you know, I just meet the person where they are. So I don't really like to name my style of therapy or coaching. It's just, I just am who I am.
One of the things too that I think is great about what you do is you don't believe in the one-size-fits-all cookie-cutter approach.
Correct.
Like every single person you're going to approach and counsel in and or coach in the same exact way. You sort of tweak, fine-tune based on the individual's needs, right?
Absolutely. Which is why when people ask me that question, well, how do you do that? I don't really have an answer for that, because it just depends on who I'm working with or who I'm interacting with. I tweak, you know, I pull out my tools and I use what I need for that particular situation with that person.
Without mentioning names, of course, people love to connect with experiences where people have had success. In your case, are there one or two examples where you've worked with somebody who was dealing with this, and through the therapy, through the counseling with you, they are now at a better place in their lives?
Absolutely. There's so many people that come to mind. There was one client that I worked with this person for a few months, probably about 3 months. And that person took a little break because life got busy and they didn't have the time to do therapy. And they came back, and the person that came back into my office, I'm like, who are you? You've changed. She's like, well, I remember all the stuff you said and I did it and it worked. I'm like, well, I must be doing my job. And that doesn't happen very often. You don't always see clients come back and you see the change. You kind of see the change a little bit at a time, but you don't see them outside of session. And so you don't really see the full healing process unless they come back and contact you and say, hey, guess what's going on in my life now? Yeah, so that was a beautiful experience.
Do you have another one to share?
Let's see. I think all the youth that I've worked with, there's a lot that come to mind. I remember during one of the heartbeat sessions, there was this one tough kid, and you know how little I am, right? I'm only 4'11". And there's this big guy who
got a lot of spunk.
Yes, I do. And all my kids know, like, I'm not one to mess with, right? And this one kid, he's over 6 feet, big, he looks like a football player.
Intimidating.
Yeah, and he's coming to me because he's court ordered to this program for a violent offense. And the first session, you know, he walks in, it's a group, and he's sitting in the corner with his arms folded, and He's got a little attitude and doesn't want to answer the questions, doesn't want to engage with the group. And I called him out. I said, you can walk out if you want to. I'm not making you come here. The court says you have to be here, but I'm not holding you here. So if you don't want to participate, you can leave. And he still sat there. And I think after probably the second or third session, he started to open up. He started sharing his story, and he was so broken. He was scared to open up. He was scared that everyone else in the room, even though he's the biggest and baddest kid in the room, he was scared that they were going to judge him.
The image that he had of being the biggest and baddest would now be destroyed.
Yeah,
right?
And he started to soften. And I think I saw the change in him immediately, but his mom, so I was checking in with the parents. His mom came back a few weeks later. It's like, what are you doing with him? He's so different.
She's liking it.
Yeah. And I get that a lot from the parents.
Isn't that incredible?
It's beautiful. It's beautiful.
That's another example of the work that you do. This work, obviously, you know, when you get the feedback like that, what happens to you inside? It must be really incredible.
It lights a fire.
Doesn't it?
Yeah, it keeps me going because it just reminds me I'm doing what God called me to do.
And when that's the case, nothing's better.
Yeah.
Relationship coaching, talk a little bit more about that. Why is it important for people to seek out a relationship coach when things are, you know, the train's coming off the track a little bit?
Yeah, I like how you describe that. I think individuals who are struggling in relationships, especially if they're going through the same type of problem with different people, a lot of times their friends are burnt out on listening to their story. And, you know, your friend is going to tell you what you need to hear to make you feel better, but it's not always going to help you and help you change your behavior. And so myself as a relationship coach, I come in with, you know, unbiased opinions. I'm just here to listen and guide you. And so that's my role, is to give them unbiased information so they can make better decisions.
So what would be, we talked a little bit about the differences between, you know, counselor and a coach, or counselor and a therapist. Who would be the person that would be appropriate to go to see a counselor, and who would be somebody that a therapist would be what they would need?
I think everyone needs a therapist, right? Whether you're going through something good or bad, you know, we all need a little guidance. But coaches they're different. Like, you have a specialty when you're coaching. So there's life coaches, there's health coaches, there's relationship coaches.
Executive coaches.
Yeah, executive coaches.
And the coaches are coached as well.
Yeah, absolutely. Yeah. And so the coach might just have that specialty. You know, therapists have specialties too, but I think therapists are trained to treat a larger number of issues. Does that make sense?
Yeah,
okay.
Right, exactly right.
Yeah.
What are the couple of reasons why you really love doing what you do? What does it bring to you? How does it sort of enrich your life, being able to help people in the way that you do?
Yeah, I live my life just knowing that if I can reach one soul, then I did what I was supposed to do, and knowing that I'm reaching multiple people, and I'm seeing the change happen in one family with, you know, it might be one youth that I work with. That youth is going to impact their family, and it's going to impact previous generations and generations to come. And so knowing that my work with someone is not just changing one life, it's changing generations.
You know, doctor, some people say that we're living in this everybody's a victim society. Tell us about how you work through that, through the work that you do.
Yeah. Well, when I think of a victim, I think of someone who's powerless, who is beaten down to the ground, can't get up, can't fight, and they've made a choice not to fight. And I don't like that mentality at all.
Right.
I think I challenge that, because anyone who has been hurt, yeah, you may have been a victim at that time, but you don't have to stay a victim. You can choose to do something different. And holding on to that victim mentality, it really keeps you in a place where you're going to be stuck forever. And who wants to be stuck?
Exactly right. Right. So again, just showing everybody the incredible opportunities they have when working with you to really take a second look at their life. Know there's hope, know that there is opportunity for guidance available, and I think it's very, very important. The other thing too is, I know you wanted to talk a little bit about how the strong Black woman identity can possibly become damaging for relationships?
Absolutely.
Explain how that is. And what is the strong Black woman identity?
Yeah. So the strong Black woman identity, it can be good or bad. There's positive and negative to that identity. So the positive side of that is it's a Black woman who chooses to overcome whatever challenge that comes her way. No matter what gets in her way, she's going to do what she needs to do. And a lot of times the negative side of that comes into play where because she does what she needs to do, she is independent, she doesn't ask for help. And so because she doesn't ask for help, she puts herself in a vulnerable position. So there may be people in her life that want to help her, but she tells herself, no, it's okay, I got it, I can do this, I don't need your help. And that limits her and limits her growth. And a lot of times in relationships, what will happen is, the strong Black woman might get into a romantic relationship and she walks into that thinking, I don't need you, I can handle everything on my own. I do want you, but I don't need you. And in the Black community, I think that's something that we talk about as a strength for women, but it is so limiting because you have to be a little soft as a woman, for one. You have to be soft to show empathy towards your partner, to receive love. You can give love, right? But if you're the strong Black woman who holds on to this, I can do this by myself and I don't need you, it's going to be hard for you to receive that love back. And all that's going to do is push your partner away. And you end up alone.
Right, exactly. Yeah. That's really fascinating to hear the way you describe it, and the understanding of all of this, I think, is so important. How do the sessions actually work? Like you said, you start with the intake. Tell us about the different kinds of sessions that you offer. And is it one session, 2, 12? Does that really vary on
it varies.
What they want, what you see?
It depends on the person, depends on their need.
Right.
As a therapist, a lot of times we start out with, I'll see you once a week. And once there seems to be some change, we can go to once every other week. And then we trickle down to maybe once a month. And then you might just come back as you need to. But sometimes what I found is, I see people for once a week for maybe 4 to 6 sessions. It might be longer than that. Or maybe they're making so much progress in 3 and we go down to once every other week. And maybe that picks back up because there's a new event that comes into play and they need to work that out.
Right.
And once they work that session out, they kind of trickle back down to every other week or once a month.
What would you say to somebody who's watching right now, Dr. Leslie, and they're loving the conversation? They're all in. They've been with us since we first said welcome. But they are nervous, maybe, or hesitant to make that plunge, to move forward. I always tell everybody there's a lot of investments you can make in life. One of the greatest is in yourself. And when working with somebody at the expert level that you are, working with Dr. Leslie, you're working with somebody who truly is caring, empathetic, understands, has been there herself, who has all the clinical and expert experience, but who really is there to want to help lift people up and help them lift themselves up. What would you say to somebody who's watching right now, who's really struggling and they're going through some deep, dark things right now, and they don't know what to do next?
Yeah. Being in that deep, dark place can be scary. It can be isolating, and that's the worst place you want to be. We're all built for connection. Even if you connect to just one person, whether it's through calling a hotline because you're suicidal and you need to talk to someone, or calling domestic violence hotline because you're in a violent situation, or taking a bigger step and actually calling to schedule an appointment to see a therapist in person. That first step, takes a lot of courage and bravery, and it's so worth it. And it's not just for you. You have to remember everything that we do, it's not just about us, it's about the next person. And so when you help yourself, you're going to help someone else.
It's really been a pleasure having you stop by our studio here at Close Up Television, Dr. Leslie. I applaud you for the extraordinary, exemplary work that you're doing.
Thank you.
And I know it comes from your heart and soul, and you're the real deal, and a pleasure to chat with. We wish you nothing but continued joy and blessing in your life and success, and hope you stay in touch with us and keep us posted on all the wonderful things you're working on.
Absolutely.
It was a pleasure.
Nice meeting you.
Seeing you in person.
Yes.
Dr. Leslie, thanks so much.
All right.
If you'd like to learn more and connect with our special guest, Dr. Leslie Davis, visit her website, ldcoachingandconsulting.com. For Close-Up Television and Radio, I'm Jim Masters. Thanks for joining us, and we'll see you again next time.